When you have a child with complex medical needs, your life operates on a different clock. Managing their care is a demanding, unpaid, full-time job that frequently forces parents to step away from their own careers. The default solution most families are handed is traditional home health nursing. It keeps your child in a familiar environment, but it relies on a delicate system with massive hidden variables. The biggest friction point is the no-show crisis. If a single nurse called out sick, the entire care system collapses, and you have to immediately abandon your workday to provide highly specialized medical care yourself. Then there is the logistical trap of fragmented therapy. Parents act as medical dispatchers, driving their fragile child across town to separate physical, occupational, and speech therapy clinics. This setup also extracts a hidden developmental cost. Home nursing inherently isolates your child from peer socialization and the structured, age-appropriate sensory play they need to thrive. While the home care model feels instinctually safe at first, it forces parents to manage a fragile, uncoordinated network. Under the pressure of daily life, that network inevitably breaks. There is an alternative framework that solves these logistical failures: the Prescribed Pediatric Extended Care Center. A PPEC, or Prescribed Pediatric Extended Care Center, is a specialized medical daycare. It is designed exclusively for children from birth to 21 years old who require continuous skilled nursing due to complex medical conditions. OhanaCare PPEC operates a dedicated facility in Lauderhill, serving families throughout Fort Lauderdale and the broader Broward County community. To regain career stability and give your child a social environment, you have to weigh a specific trade-off: exchanging the quiet, one-on-one familiarity of your living room for a structured clinical facility. We are going to systematically compare the OhanaCare PPEC model against traditional home care on 3 specific vectors: reliability, visibility, and financial logistics. Transitioning your child's care is an emotional step. This choice represents a strategic decision to move from surviving a fragmented system to thriving in a consolidated medical ecosystem. Let's look at the reliability of medical staffing. Traditional home care is a single-node system. If one nurse is absent, you have 0 care for the day. This animation contrasts that vulnerability. OhanaCare relies on a team-based ecosystem of registered nurses, or RNs. Because it is a network, they guarantee continuous, unbroken coverage Monday through Friday from 7 a.m. to 7 p.m. The facility is equipped to handle severe, highly complex conditions. They utilize hospital-grade monitoring for children requiring tracheostomy care, ventilator support, tube feeding, and management of genetic disorders. The second part of this trade-off is therapy. Instead of packing up your car and driving to 3 different clinics, OhanaCare integrates physical, occupational, and speech therapy directly into your child's schedule, all under one roof. These therapies are conducted in specialized rooms designed specifically for different developmental stages, featuring sensory-friendly lighting and acoustics. The reliability trade-off requires giving up the exclusive attention of a single home nurse in exchange for a guaranteed team that never calls out and entirely eliminates your logistical commute. Even with reliable care, parents face a deep emotional hurdle: the black box effect. Dropping off a medically fragile child creates anxiety about losing physical, constant visibility of their well-being. OhanaCare mitigates this anxiety using a family portal app called Playground. The app bridges the physical distance by providing granular, real-time updates on your child's routine. Parents receive instant digital logs for essential activities, so you know exactly when they are taking a nap, receiving fluids, or getting a diaper change. While the app gives you visibility, the facility gives your child a community. The primary benefit of this environment is overcoming the severe isolation of homebound care. Your child participates in structured sensory play, group learning, and peer socialization. This all happens within ADA-accessible spaces, monitored under strict infection control and air filtration protocols. OhanaCare trades physical proximity for digital transparency. You can confidently return to work knowing your child is building a vital community of peers. The final barrier is usually the assumption of cost. A state-of-the-art facility staffed with registered nurses and specialized therapists seems like an insurmountable financial strain. This chart shows the actual financial reality. For eligible children, OhanaCare PPE services, including nursing, therapy, and daily care, are 100% fully covered by Medicaid and Medicaid Health Maintenance Organizations, or HMOs. That leaves one final logistical friction point: how a working parent is supposed to physically transport a wheelchair-bound or oxygen-dependent child to Lauderhill twice a day. OhanaCare solves this by providing free, wheelchair-accessible vans exclusively for Medicaid recipients. They handle the safe travel between your home and the center. Navigating the prescription and enrollment process can be overwhelming, but the OhanaCare team actively assists parents in verifying their eligibility and securing coverage. The PPEC model is explicitly engineered to remove every financial and logistical excuse. It turns a premium medical service into a highly accessible right for eligible families. This matrix evaluates your child's care. The horizontal axis tracks logistical freedom. The vertical tracks therapeutic growth. If absolute isolation is required, the bottom left, home nursing, is necessary. For social integration, the top right is optimal. OhanaCare PPEC. Transitioning to a PPEC requires an emotional leap, but the return on that decision is a guaranteed 12-hour care team, centralized multi-therapy, and zero out-of-pocket costs with Medicaid. To take the next step, utilize OhanaCare's fast and free Medicaid eligibility check to see if your specific managed care plan qualifies. You can also download their free parent guide to understand the step-by-step enrollment process. OhanaCare PPEC restores your child's right to a vibrant daily life and returns your role as a parent, ending the constant pressure of medical coordination.